Liver cancer is one of the deadliest malignancies today, and what makes it so dangerous is that it often develops silently, showing no obvious symptoms until it reaches an advanced stage. The liver, located in the upper right abdomen, performs over 500 vital tasks, including detoxifying harmful substances, breaking down fats through bile production, and maintaining hormonal and metabolic balance. According to the American Cancer Society, the incidence of liver cancer has increased by more than 300% since 1980, with mortality rates doubling over the same period. Globally, liver cancer now ranks as the sixth most commonly diagnosed cancer and the third leading cause of cancer death, accounting for more than 830,000 deaths annually, as reported by the World Health Organization in 2022. But here's the hopeful truth: early detection can drastically improve survival rates. For patients diagnosed in the early stages of hepatocellular carcinoma, the 5-year survival rate can be as high as 33%, compared to less than 5% in late-stage diagnoses. That's why knowing the warning signs isn't just helpful, it could be life-saving. In this video, we'll walk you through 11 early symptoms of liver cancer that often go unnoticed, yet hold the key to timely intervention. Stick around until the end to discover proven strategies for keeping your liver strong and disease-free. 1. Nausea and vomiting. One primary reason is the liver's compromised ability to detoxify the blood. The liver filters out toxins and various byproducts of metabolism, preventing them from causing harm. When liver function is impaired by cancer, toxins may build up in the bloodstream and affect the brain and digestive system, leading to feelings of nausea. Additionally, liver cancer may cause changes in metabolism and the digestion process. The liver produces bile, which is essential for breaking down fats in the diet. If a tumor obstructs the bile ducts, the flow of bile is reduced or blocked, disrupting normal digestion and often resulting in nausea and vomiting, especially after meals. The presence of a large tumor or multiple tumors in the liver may also physically press on the stomach and other digestive organs, which may mechanically interfere with the normal function of these organs and contribute to nausea and feelings of fullness. Moreover, the psychological stress of dealing with a serious illness like liver cancer may trigger or worsen nausea. Stress may affect the stomach and how the brain interprets signals from the digestive system, making a person feel nauseous even without direct physical causes from the liver itself. Furthermore, patients with hepatocellular carcinoma often have associated conditions like cirrhosis and gastric esophageal varices. Severe nausea and vomiting in these patients may cause these varices to bleed, which is a serious complication that may lead to death. 2. Fever. Fever in liver cancer is more than just a reaction to infection. It can signal deeper systemic dysfunction and aggressive tumor behavior. Clinical observations reveal that up to 30 to 40% of hepatocellular carcinoma, HCC, patients develop persistent or intermittent fevers during the course of the disease, especially those with tumor sizes exceeding 5 centimeters or multiple lesions. This rise in body temperature often coincides with a marked elevation in neutrophil counts, reflecting either an infection or an ongoing inflammatory response. Under normal circumstances, the liver plays a critical role in filtering out bacteria and toxins that enter the bloodstream, particularly from the gastrointestinal tract. However, as liver function declines due to tumor infiltration and damage, this protective barrier weakens. Bacteria that would otherwise be cleared may proliferate, leading to systemic infections and, consequently, fever. Moreover, large tumors can undergo internal necrosis, where cancer cells die due to lack of blood supply. This cell death releases damage signals that trigger the immune system to respond, causing a surge in pro-inflammatory cytokines, such as IL-6 and TNF-alpha, which are well-known pyrogens, fever-inducing agents. In some cases, these fevers can reach above 38.5 degrees Celsius (101.3 degrees Fahrenheit) and may be accompanied by chills, or night sweats, mimicking infectious processes but stemming from cancer-related inflammation. Recognizing fever as a possible manifestation of liver cancer is crucial, especially when no clear infection is found. Early investigation may uncover otherwise hidden tumor activity. 3. Easy bruising or bleeding. Since the liver is responsible for producing clotting factors, patients with chronic liver disease often experience coagulopathies. It may lead to easy bruising and bleeding, particularly in the gastrointestinal tract. Additionally, liver cancer may exacerbate the condition known as thrombocytopenia, where there is a reduced number of platelets in the blood. Platelets are cell fragments that play a vital role in blood clotting. When the liver is not functioning properly, it may affect the production and lifespan of platelets, further complicating the clotting process. The liver also plays a role in regulating the balance of various other substances in the blood, including enzymes and other proteins that control clotting and bleeding. When liver function is compromised, this balance may be disrupted, leading to an increased risk of bleeding. Moreover, liver cancer may cause portal hypertension, which is an increase in the blood pressure within the portal venous system. This condition may lead to swollen veins, varices, in the esophagus and stomach, which are prone to bleeding. 4. Chronic fatigue. Fatigue is a prevalent side effect of cancer, often continuing for years after treatment has ended, even in survivors who are otherwise healthy. The liver is integral to various metabolic processes, including the regulation of sugar levels in the blood and the conversion of nutrients into energy. When liver cancer may impair these functions, the body's energy metabolism may become less efficient. This inefficiency means that despite consuming nutrients, the body may not be able to convert them into usable energy effectively, leading to persistent tiredness. Furthermore, liver cancer may lead to anemia, a condition where there aren't enough healthy red blood cells to carry adequate oxygen to the body's tissues. The liver plays a role in producing substances that aid in the creation of red blood cells. When liver function is compromised by cancer, this production may be hampered. It leads to fewer red blood cells and, subsequently, less oxygen being transported throughout the body, which contributes to fatigue. Additionally, the immune response to cancer may also be a factor in fatigue. The immune system may release various cytokines in response to cancer, which are proteins that help regulate the immune system and fight the disease. However, some cytokines may lead to inflammation and a feeling of being tired all the time. Moreover, the psychological impact of dealing with a chronic and life-threatening illness such as liver cancer may lead to or exacerbate feelings of fatigue. Stress, anxiety, and depression, which are common among cancer patients, may also play significant roles in how tired a person feels, both mentally and physically. 5. Dark urine. Dark urine can be one of the earliest external signs that liver function is deteriorating, often going unnoticed until it becomes unmistakably abnormal. Under healthy conditions, bilirubin, a yellow compound produced during the normal breakdown of red blood cells, is processed by the liver, converted into a water-soluble form, and then excreted through bile into the intestines. This pathway not only aids digestion but also keeps bilirubin levels in check. However, in patients with liver cancer, studies indicate that biliary obstruction or impaired hepatic clearance occurs in over 40% of advanced cases. As tumors damage liver cells or block bile ducts, this detoxification process falters. When bilirubin builds up in the bloodstream, the kidneys act as a secondary filter, attempting to eliminate the excess through urine. This gives the urine a dark brown hue, often described as resembling black tea or cola, in contrast to the normal pale yellow. In fact, a rise in serum bilirubin above 2.5 mg per deciliter is typically when this change in urine color becomes visible. While dark urine can result from other factors such as dehydration or medications, when it appears alongside fatigue, jaundice, or abdominal pain, it should raise immediate concern about potential liver dysfunction, including malignancy. 6. Jaundice. Jaundice is observed in 19 to 40% of patients with hepatocellular carcinoma at the time of diagnosis, typically indicating that the disease has reached an advanced stage. Under normal circumstances, the liver converts bilirubin into a form that may be eliminated from the body through bile. It is a fluid produced by the liver that helps digest fats. When liver cells are damaged by cancer, this process is disrupted. The liver may become less efficient at converting and excreting bilirubin, causing its levels to build up in the blood. As bilirubin levels increase, it may start to deposit in tissues throughout the body, leading to the characteristic yellow color of the skin and eyes that defines jaundice. Additionally, liver cancer may lead to blockages in the bile ducts, the pathways through which bile flows from the liver into the intestines. When tumors block these ducts, bile, and consequently bilirubin, may not exit the liver effectively. This backup not only increases bilirubin levels but may also exacerbate liver damage, creating a cycle that further impairs bilirubin processing. 7. Swelling in the abdomen. The liver plays a crucial role in regulating various substances in the blood, including proteins such as albumin. Albumin may help maintain the oncotic pressure in the bloodstream, which is essential for keeping fluid within the blood vessels. When the liver is damaged by cancer, its ability to produce albumin diminishes. With lower albumin levels, fluid starts to leak out of the blood vessels and accumulate in the abdominal cavity, leading to swelling. Additionally, liver cancer may impair the liver's ability to clear hormones and other substances from the blood. This impairment may disrupt the balance of fluids in the body, further contributing to fluid buildup. The liver is also involved in managing blood flow to various organs. As tumors grow, they may obstruct blood vessels within the liver, leading to increased pressure in the portal vein, the major vein that carries blood to the liver from the intestines and spleen. This condition, known as portal hypertension, may exacerbate fluid leakage into the abdominal cavity. When patients with a history of cancer, whether it's inside or outside the abdomen, develop ascites without having liver cirrhosis or other benign causes, this accumulation of fluid is typically considered to be due to malignancy. 8. Upper abdominal pain. People with liver cancer often experience upper abdominal pain. It is a common symptom due to the location and function of the liver. This pain is primarily caused by the growth of the tumor within the liver itself, which may stretch the liver's capsule. The liver capsule is a thin layer of tissue that encases the liver. When it's stretched by a growing tumor, it may cause significant discomfort and pain in the upper right side of the abdomen, where the liver is situated. Additionally, as the tumor grows, it may start to press on adjacent organs and tissues. This pressure not only contributes to the pain but may also lead to a feeling of fullness in the abdomen, further exacerbating discomfort. The liver is in close proximity to other vital organs, such as the stomach and intestines. Thus, any expansion or shift due to a tumor may impact these areas, potentially leading to more widespread abdominal pain. Liver cancer may also lead to the development of ascites, which is the accumulation of fluid in the abdominal cavity. This fluid buildup increases pressure throughout the abdomen, contributing to abdominal pain. Ascites are often a result of the liver's decreased ability to produce proteins that help keep blood from leaking out of blood vessels and into body tissues, a key function of a healthy liver. In a study of liver cancer patients in Taiwan, the most frequent symptom observed was abdominal pain, experienced by about 76% of the patients. This pain, often dull and deep, was caused by the growth of the tumor mass in the liver. 9. Loss of appetite. A noticeable loss of appetite is a frequent and distressing symptom among people living with liver cancer, often diminishing their energy levels and overall well-being. Studies show that up to 64% of patients with advanced hepatocellular carcinoma report significant anorexia. This decline in the desire to eat, clinically known as anorexia, stems from the liver's deeply integrated role in digestion and nutrient regulation. One of its primary jobs is producing bile, a fluid essential for breaking down dietary fats and for flushing waste from the body. When cancer disrupts bile production, fatty foods become harder to digest, making meals feel uncomfortable or even nauseating. Over time, the brain begins to associate eating with physical discomfort, resulting in a subconscious avoidance of food. On a deeper level, liver cancer also throws off the hormonal signals that regulate hunger. For example, leptin levels may become abnormally elevated, which suppresses appetite, while ghrelin levels may decrease, reducing the natural hunger signal. These imbalances are commonly observed in patients with chronic liver disease and cancer, contributing to a vicious cycle of malnutrition. Combined with the systemic inflammation driven by the tumor and immune response, which further suppresses appetite through cytokines like TNF-alpha and IL-6, the result is a multifaceted decline in appetite that compounds the physical and emotional burden of liver cancer. 10. Unexplained weight loss. Unintended and persistent weight loss may be one of the earliest warning signs that liver cancer is silently progressing beneath the surface. This alarming symptom is often a result of cancer-related cachexia, a syndrome that causes not only fat loss but also rapid muscle wasting. In hepatocellular carcinoma, the most common form of primary liver cancer, cachexia is reported in up to 50% of patients at diagnosis, and its presence correlates strongly with poorer outcomes. The liver, already compromised by tumor invasion, loses its ability to store nutrients, produce albumin, and regulate metabolism. Meanwhile, cancer cells consume glucose and amino acids at a far higher rate than normal cells, triggering a dramatic energy deficit. In an attempt to counteract this, the body raises its basal metabolic rate by as much as 20% to 30%, requiring more calories at a time when food intake is already declining. Compounding the issue, pro-inflammatory cytokines like interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha, are released by the immune system, which suppress appetite and interfere with carbohydrate and lipid metabolism. These cascading effects often lead to substantial, rapid weight loss, sometimes over 10% of total body weight in a few months, well before jaundice, pain, or other liver cancer symptoms appear. Maintaining liver health is vital for overall well-being. Here's how you may keep your liver functioning optimally with added context for each strategy. Maintain a balanced diet. Consuming a varied diet rich in fruits, vegetables, lean protein, and whole grains help provide essential nutrients that support liver function. Stay hydrated. Water flushes toxins out of the liver and facilitates a more efficient metabolic process. Adequate hydration also prevents the liver from overworking, as it helps dilute substances that might be harmful. Limit alcohol consumption. Alcohol is metabolized by the liver, and excessive drinking may lead to inflammation, a fatty liver, and even liver failure. Moderating alcohol intake may help prevent these conditions and keep liver cells healthy. Exercise regularly. Physical activity may help to burn triglycerides for fuel and reduce liver fat. Thus, it prevents obesity-related liver diseases. Avoid toxins. Exposure to harsh chemicals and pollutants may damage liver cells. Use protective gear when handling chemicals and ensure proper ventilation to minimize inhalation of harmful substances. Prevent infections. Viruses like hepatitis may severely affect liver health. Simple hygiene practices like regular hand washing, avoiding shared needles, and having safe sex may prevent these infections. Control weight. Excess body fat may lead to non-alcoholic fatty liver disease, which may progress to more serious liver damage. Managing your weight through diet and exercise may prevent these outcomes. Quit smoking. Smoking contributes to oxidative stress, which may cause inflammation and fibrosis in the liver. Quitting smoking reduces these risks and supports overall liver health. If you experience any of these symptoms persistently, it is important to consult with a healthcare provider who may perform appropriate tests, such as blood tests, imaging studies, and liver function tests, to determine the cause. Awareness and early intervention are key to managing liver cancer effectively. Regular checkups and being mindful of bodily changes may help in catching this disease early, leading to better management options and outcomes. Liver cancer is a silent but deadly disease, often showing no clear symptoms until it has progressed significantly. However, as we've seen throughout this video, the body does offer subtle yet important warning signs, from unexplained weight loss, fatigue, and dark urine, to jaundice, abdominal swelling, and changes in appetite. Recognizing these early symptoms can make a crucial difference, not only in diagnosis but also in improving treatment outcomes and survival rates. Equally important is protecting your liver before problems start. Maintaining a balanced diet, staying physically active, avoiding alcohol and toxins, managing your weight, and preventing infections like hepatitis, all of these are proactive steps that support long-term liver health. Your liver does so much for your body, filtering toxins, balancing hormones, aiding digestion, so don't ignore what it might be trying to tell you. If you found this video helpful and want to stay informed about more life-saving health tips, don't forget to like, share, and subscribe to our channel. Your health is your greatest asset, and we're here to help you protect it, one video at a time.